Evita Walton's son is supposed to be in school today, but some symptoms got in the way.
He had a runny nose this morning, and a bit of a stomach ache, so he can't go to school until we get it cleared.
She may be waiting for a while. The province is struggling with a backlog of 82,000 tests, and time is ticking.
These specimens are only good for 3 days, and then they spoil, and people have to be retested. So we understand how urgently this needs to be addressed.
The government says it's turning to university labs for help, while reminding people to abide by the testing guidelines.
If you aren't showing symptoms, please just don't go get tested.
As of today, kids with runny noses no longer make the cut either.
In the vast majority of cases, it is not COVID-19.
Those kids are being told to stay home. And if they have 2 or more symptoms, parents are told to seek the advice of a healthcare provider first. As for what's needed to go back to school once clear of symptoms,
schools and daycare should not be requiring a negative COVID test. In fact, they shouldn't even require a doctor's note.
It's essential that we have rapid turnaround.
This infectious disease physician thinks this move will help clear an already clogged system.
We may have to talk about restricting who gets tested even more. And again, finding those low risk to public health, but still positive people to just isolate at home for 14 days and focus on the symptomatic people.
But with the focus and messages changing almost daily, it's confusing for parents like Evita Walton.
When I was reading through what the criteria were for testing, I didn't see how they were going to tell us not to.
She's now heading home and hoping for a negative result. Magda Gebrselassie, CBC News, Toronto.
Now, most of Ontario's new cases are in the Greater Toronto Area and Ottawa. The Premier was asked today if restaurants in those areas could soon face more restrictions, like shutting down indoor dining.
Not right now. Again, everything's on the table. If you ask me, in 4 days and we're up over 1,000, things could change, but not right now. We just want everyone to continue following the guidelines.